if I want to map the health economics, I will start with what is health. I will start with what is health. If I understand what is health, that has an impact upon demand for health or health care. If I have a demand for health care, or I want to know the demand, or I want to generate some demand, I am interested in that, I would like to know what is health. I will Google it, I will ask my friends, or I will go to a doctor. So, it is a both way relationship. Based on my demand for health, or I will keep it as what influences health. I can keep as demand for health. If I know that if I smoke, it causes me cancer, and I didn't know that, I smoked, and now I suddenly realize, oh my God, I used to smoke quite heavily. And what I do, I want to learn that now what happens with this smoking behavior. I learned that it causes cancer. So I am afraid now, I have a family. I want to go to a doctor, and that generates my demand for health care. Then what influence, or if I am staying in Delhi, it's highly, the air is highly polluted. Yeah, so I want to go for a regular checkup for my acute respiratory infections or asthmatic conditions, whether I have developed or not, or whether I have a chance or not to develop a certain condition. Therefore, for the demand for health care, I also need to have a supply of health care, because I may have a demand, I may not have a supply. So, in a particular market scenario, the demand and the supply should be matched. So, as the demand will look for a supply, the supply would also look for a demand. Otherwise, go back to my previous slide or previous chart where I talked about it causes inefficiency if the demand does not match the supply, allocative inefficiency, right. So, the demand and supply should be linked to each other very, very closely and should be evaluated that whether demand meets the supply or supply meets the demand. We will talk about the demand and supply more in detail in our next session. So, this demand and supply, this relationship leads to a market analysis, because whenever we talk about demand and supply, this is a market mechanism, and when we want to understand that mechanism, that whether I am towards achieving an efficiency or not, or whether my system is very inefficient, I have to do a market analysis. After doing that market analysis, now the government takes the decision, right? They take the decision. I can just demand it, yeah, and I will just see whether there is a supply or not. So, the government has to take the decision whether there is a demand, or whether the demand has to be generated, or if there is a demand, whether there is enough supply or not. So, after this market analysis, I bring a macroeconomic appraisal. Again, macroeconomics is at the state or the country level, where the government takes the decision. At the individual level, at the microeconomics, we take the decision. So, we do a macroeconomic appraisal. We do a macroeconomic appraisal. So, when we do a macroeconomic appraisal, then it leads to planning or budgeting, now the amount of money the government will provide to the states of Bihar, Orissa, Jharkhand, UP, Chhattisgarh to work on undernutrition. The same money probably they will not give to the states like Kerala or Punjab. There they may look at other diseases which are basically non-communicable diseases, cardiovascular diseases, the diabetic problems, hypertension, because it is after this the market analysis, the government has an idea that which kind of demand a particular state or a particular population has, what kind of supply is required or how much supply I do have, and then they do a macroeconomic appraisal that for non-communicable diseases how much needs to be invested, where it needs to be invested, and how it needs to be invested, and they are very, very different for these infectious diseases or diseases related to chronic energy deficiency, that is undernutrition. So this comes as an outcome for this government, and this planning and budgeting finally affect the supply and demand for healthcare, because then this provision comes, and this what influences health, what is health, and the demand for healthcare, this primarily is the macroeconomic analysis. So I can keep it like this together, and this is my microeconomic analysis, because this is at an individual level or a household level. Therefore, this macroeconomic analysis not only determines the planning or budgeting, eventually the microeconomic analysis also determines the planning and budgeting, and finally the regulation mechanisms from the government's point of view. So this is a map for health economics, or how health economics works in the society. Yes. So this is as far as our basic overview about what we do in health economics, what we study in health economics, or the broad health economic variables. The next session we will talk about the market mechanism and the demand and supply of healthcare or the consumer behavior. So the microeconomic perspectives connecting healthcare. So here, before finishing this session, I will give you a broad overview about the health expenditure. Two major indicators of health expenditure in terms of either we think of government or we think of individual level. If we are thinking of individual level, there is a concept of out-of-pocket expenditure, which is nowadays highly researched. That's primarily because in the poorer countries, this out-of-pocket expenditure has been identified as the major cause towards poverty. Because it causes you causes us a vicious circle of poverty. If a person from a poor family who cannot afford healthcare is falling ill, they cannot go to work, they lose their salary. If he has to be taken to a city which is far away for the treatment, and that takes longer time or longer, that takes transportation cost as well, so which contributes towards their income loss or other costs, if not directly towards the treatment cost. Therefore, their family members, if they are accompanying them, they are also losing their income for a longer period of time. So, and if further, the treatment seeking is expensive, then there is another addition, that's the main component of healthcare cost is adding up. Together, the healthcare expenditure is rising, and when in these poorer countries, the poor families don't have the health insurance because they often think that from health insurance we are not gaining back anything, and they often cannot recognize their health related problems. So their health seeking behavior is poor, and hence they don't want to invest, which is not giving them any return visibly in a shorter period of time. So that is a luxury to having to have a health insurance, which in a developing market in terms of health insurance in these countries are mostly a private health insurance. So though the government of all these countries are making their best initiatives to penetrate towards these poor people. Therefore, this out-of-pocket expenditure comes into picture because they are not, covered under any health insurance. Nobody is basically pooling or paying against their risk. So there is no risk pooling. Therefore, they have to pay the entire health care treatment cost from their pocket, which is known as out-of-pocket, directly coming out of pocket. Yeah, out-of-pocket expenditure. You can go to this World Bank websites, which gives almost all countries World Bank website. I don't really remember the website, but you can just type in Google World Bank and healthcare cost or out of pocket expenditure, and then that World Bank website gives you a detailed information over the period of time across all the countries on this out of pocket expenditure, percentage of their total health expenditure or the total expenditure, total household expenditure. It is generally understood that when a country is poor, their out-of-pocket expenditure is more. Taking an example, if Australia pays, in 1995, in 2014, Australia used to pay 16.1% of their healthcare expenditure out of their pocket, and in 2014 it was 18.8. Where is Bangladesh? Where is Bangladesh? It was more than 60%. So yeah, 60%. And as the health seeking behavior is improving, they are going to the doctors and mostly funded by themselves. The percentage is also increasing over the period of time. In some cases they have reduced because the government schemes providing them free insurance and all, but not in all the cases. In say in Netherlands, it has been eventually less than Netherlands and France. It has been eventually less than 10%. In Netherlands is 5.2%, in France it is 6.3% in 2014. In India, it was 67.5, it has come down to 62.4. Yeah, if I don't note down here, in China they have reduced this out-of-pocket expenditure by a large margin from 60%, 46% in 95 to 32% in 2014. Sri Lanka, they have again less than around 40%. It was 45.1, now it is 42.1. Taking a couple of examples from the most two prominent prominent developed countries, USA and UK. In USA, it has been 11% in 2014, whereas in UK it has been 9.7%, and we often feel very proud when we compare ourselves as a nation with Pakistan, and this Pakistan's health expenditure, out of pocket expenditure as a percentage of their health expenditure has been 56.3%, coming down from 72.1 in this 20 years. So ours one was 62.4, whereas Pakistan is in 52%. The other prominent health economics measure is the health expenditure in terms of percentage of GDP, the public health expenditure, that is how much the government pays in terms of the GDP, gross domestic product of the country. So in here, a developed country will always pay higher, because in most of the developed countries the money comes from the government, or through taxes. So if I take the random examples, say in Denmark, it has been 9.2% in 2014. I am not showing the the difference. It has increased from 95 to 2014 by 2.5%. It was 6.7. Now in Denmark it is 9.2. In China, it has increased from 1.8 to 3.1. In India, it has been pretty stagnant, 1.1 to 1.4. In Bangladesh, it has been 0.8. In Pakistan, it has been 0.9, whereas in Sri Lanka, it has been 2, and in UK and USA, it has been 7.6 and 8.3, 7.6 and 8.3 respectively. So this is the health expenditure, public health expenditure as a percentage of GDP, of that particular country's GDP. So when we look at the private expenditure, it is again it is little dubious, and then in India, of course, it is higher as compared to the public health expenditure, and in India the private health expenditure as a percentage of GDP is higher, because the the government facility is not very prominent, or does not reach to all the sections of the population. So it has been 3.3% in 2014. In China, it has been 2.5. In Germany, it has been 2.6. You can compare in USA and UK. It has been 1.5. As I said in my earlier earlier part of my lecture, that in UK it is mostly coming from the government through taxes. So the private health expenditure has been pretty low, and it has been only 1.5% out of their GDP. And USA, again, their contribution towards the private health expenditure is higher, and the percentage of GDP is 8.9%. So when we talk about another indicator, that health expenditure per capita, when we talk about health expenditure per capita, that means health expenditure, it's in an average for one individual. So it's the total health expenditure divided by the total population, given in US dollar, and the base price is 2011. And then again, for the developed countries, it is way higher. Yeah. So because they have a better healthcare facility, they are paying for the insurance, or the government is paying for them, the healthcare provision is good, and therefore the expenditure is high, be it from the individual payment, or the insurance based payment, or the government payment through taxes. So it's the total healthcare expenditure. And finally, their awareness and the health seeking behavior is quite good. So they go for a regular health checkup, they have knowledge about the health perspectives. Yeah. So in Australia, again, it has been 4,357 in 2014. In China, it has increased from 64 to 731 US dollar per capita per Chinese population. In India, it has increased from 60, but it has increased at a pretty slow rate as compared to China, to 267. So we spend 267 US dollar per capita, per individual in 2014. In Sri Lanka, it has been high as compared to India. Sri Lanka has been doing pretty well in terms of their demographic indicators, development indicators. In UK, you can obviously see it's fairly high, and in USA, again, because mostly coming from the private facilities, so the cost is higher. It is 3788 in 1995 and now 9403 in 2014. So we can see the healthcare expenditure increases with the development, with the awareness, with the education, with the health-seeking behavior. In most of the sub-Saharan countries, the healthcare expenditure per capita has been around 100 US dollar. It can be 60, it can be 80, it can be 100, it can be 120, but not more than that. In 2014, it's not very fascinating over there. And finally, the health expenditure as a percentage of GDP, the total health expenditure as a percentage of GDP is again will be higher, because the health expenditure is higher. So the health expenditure in terms of as compared to the country's total income has been higher in developed countries. So in Australia, it has been more than 15% during this period. It was 14.9, now it's 17.3% of GDP goes to health or health causes. In Bangladesh, it's 5.7. In Canada, 18.8. China, 10.4. India 5. Yeah, even lesser than Bangladesh. Pakistan, very close to India, 4.7, where USA and UK are pretty high. UK is 16.5 and USA is 21.3. So you get a broad idea about how we are doing as in terms of macroeconomic perspective, that or the microeconomic perspective, that the developing countries and developed countries, and say from different regions, USA, the European countries, the Southern Asian countries, and then China. And to mention another country, Korea has been doing pretty well in terms of their demographic indicators, which encompasses health, of course, and the out-of-pocket expenditure has reduced fairly. The healthcare expenditure has increased in terms of percentage of GDP, even though we almost have got our independence at the same time. So we share the same Independence Day, India and Korea, but Korea has been doing exceptionally well during last 3 decades. And so just giving you a broad overview about this, you can further check these documents, these details, freely available. You can download them as an Excel file or Word file and do some simple statistical analysis. You can download them from this World Bank website. Just get this health expenditure, out-of-pocket expenditure, percentage of GDP. Even you can get some basic the demographic indicators, say infant mortality rate, the death rate, the birth rate, and all these things, and you can do some basic analysis, what is the impact of healthcare expenditure on, say, declining death rate and all this. Yeah, so thank you very much. See you in the next session.